Hello, everybody. I'm Motaz, your German instructor, and I'm glad to be with you today. We're going to have our module today, and we'll talk about healthcare and emergency situations in Germany. So I will first share the screen. So, healthcare and emergency situations. First, I want here to mention some basic information about the origin of healthcare in Germany and how it's developed over time. The beginnings of the healthcare in Germany can be tracked back to the Middle Ages, where craftsmen were members in guilds. Guilds provided a primary form of health insurance based on the principle of solidarity. That means that all members of the guilds paid into funds which were then used for helping the individuals that having financial difficulties in case of illness, for instance. Anyone covered under this health insurance granted right to free medical treatment, medicines, sickness benefits, for example, and also funeral allowance. There were also some other insurance funds designed for or organized for the factory workers at the beginning of the Industrial Revolution. And these different types of insurance funds were standardized through the Otto von Bismarck's social policies. Otto von Bismarck is, by the way, is the founder of the German Empire, and he oversaw the unification of the German state. So he was the founder of the German state, and he was the first chancellor of the German state for 19 years in the 19th century, from 1871 to 1890. So these different types of insurance funds, whether the health insurance, for example, that were designed for the Geld members in the Middle Ages, or the insurance funds designed for the factory workers in the 19th century, all of them were standardized through the Otto von Bismarck's social policies in the late of the 19th century, and in particular in 1883. In 1883, the health insurance in Germany was introduced with the primary goal to provide insurance for all workers in industrial and non-industrial productions in the event of illness. About 10% of the population was covered under this health insurance, compared to almost 100% of the Germans nowadays. Everyone covered under this health insurance at that time had the right to free treatment, free medical treatment, and medicines also, and other sickness benefits, and also finally the funeral allowance. The introduction of the health insurance in 1883 was closely followed by two types of other insurance funds. The first insurance type was the statutory accident insurance that was introduced in 1884, and the pension funds was introduced in 1889. Then the unemployment insurance was introduced but then in 1927. That's information, basic information about the origin of the healthcare system in Germany and how it's accompanied by the principle of solidarity. It's so important to know how the healthcare system and how the health insurance system in Germany origined and that also its origin has something to do with the principles, and in particular the solidarity principle. Because the principles I have mentioned um, a, in a module, in preceding module, that principles extend to all aspects of life in Germany. They aren't only on paper or they aren't only theoretically, but it can be applied and anyone can see these principles in the daily life in Germany. So one of the principles in these aspects of today's module, which is healthcare in Germany, is the solidarity principle, and upon which the healthcare system in Germany, and in particular the health insurance system in Germany, was origined and developed. Um, Facts about healthcare in Germany. Germany has one of the best healthcare systems in the world, with mandatory health insurance covering nearly all residents. And to this point, I want to mention also the principles on which the healthcare system in Germany based. The first principle is compulsory insurance. That means that everyone has to have the statutory insurance, health insurance in Germany, provided that his gross earnings is up to the income threshold of 73,800 euros annually, which is 6,150 euros monthly. And anyone earns more than that limit can choose to have the private health insurance. So the first principle on which the healthcare system in Germany is based is the compulsory insurance. It's mandatory. The second principle is the principle of solidarity. The principle of solidarity, excuse me, the principle of solidarity, as I've mentioned, on which the healthcare system in Germany is origined and developed from the Middle Ages, from the craftsmen and guilds to the factory workers by the beginning of the Industrial Revolution. And that's why it's a very important principle on which the healthcare system in Germany is based. So the principle of solidarity, that means that in the German healthcare system, all members of the statutory health insurance jointly carry the individual risks of the costs of the medical care and in case of illness. All the services, all the costs of the medical services incurred by the covered patient in the event of his illness. So, regardless of the income, an covered, a covered patient or a covered insured individual have the right to free medical treatment and also an equal right to continued payments of his wages during his illness. Regardless of income, of his income, or regardless of his premium levels. But premiums are based on income. And that means that the rich people can help the poor and the healthy can help the ill people. However, the premiums are calculated based on a percentage scaled up to a certain amount of about 5,512 and half euros per month, which is 66,150 euros per year. And that's the amount, that's the maximum amount for premium that a statutory insured patient have to pay for his premium in the statutory health insurance. In case of the earnings, for example, the earnings exceeds these limits, then the patient only pay this maximum premium, 5,512 and half euros per month, which is 66,150 euros per year. And that's the second principle on which the healthcare system in Germany is based, which is the principle of solidarity. The third principle is funding through insurance premiums. The healthcare system in Germany is funded from the premiums paid from the employees or paid by the employees and their employers. And also the tax revenue surpluses can contribute. But I want here to mention some examples in order to get a better idea of what I mean. The first example, for example, for the healthcare system that's funded by the state. And a second example, the healthcare system that's funded, that's market-oriented funding. That means that's not funded by the state. We have, for example, Germany. The first example, the healthcare system in Germany is funded through the premiums, as I've mentioned, and also the tax revenue surpluses can contribute. In countries like Sweden or Great Britain, for example, the healthcare system is funded, it is called state funded, that means that's funded through the tax revenues. On the other hand, we have the market-oriented healthcare system in the USA, in which every individual has to carry his own medical costs and also to bear any earning losses in the event of illness. Or on the other hand, he can get the private health insurance. These are two examples that clarify the difference between the state-funded healthcare system and the market-oriented healthcare system within countries. So this is the third principle on which the healthcare system in Germany is based, which is funding through insurance premiums. So we have the first principle is compulsory insurance. It's mandatory to have health insurance in Germany. The second principle, principles of solidarity. The third principle, the principle of funding through insurance premiums. And finally, we have the principle of self-governance. Why the German state set the conditions for medical care in Germany? The further organization and financing the individual medical services is the responsibility of the self-governing entities within the statutory health insurance system in Germany. It's not the responsibility of the German state. And that's made up of these self-governing entities made up of members representing doctors, members representing dentists, members representing psychotherapists, members representing hospitals, and insurers, and finally, insured people, insured patients. And the Federal Joint Committee is the highest entity of the self-governance within the statutory health insurance system in Germany, the Federal Joint Committee. And I will add some information about the Federal Joint Committee in the illustration later on. So these are the four principles on which the healthcare system is based in Germany. And you'll find this information also on my own PPT that will be available in the portal on Friday maximum. So pharmacies, which is called in German Apotheken, play a crucial role as many medications require a prescription and pharmacists provide medical advice. Let's take a close look at pharmacies and its role in the healthcare system in Germany. Role of pharmacies or Apotheken in Germany. That's the German term. That's the equivalent term in German. Provide prescription and over-the-counter drugs. Pharmacists provide prescription drugs as well as over-the-counter drugs. Offer expert advice on correct dosage, application, potential adverse effects, and drug or food interactions. Offer expert advice on correct dosage, application, potential adverse effects, and drug-food interactions. So the role of the pharmacists doesn't have only with giving advice, giving a medical advice, giving advices about the medications or the medicines, or only dispensing prescriptions, whether they are prescriptions for over-the-counter drugs or written by a doctor. Yeah, it's beyond than that. Conducts medication reviews to ensure effectiveness and safety, especially for patients with chronic conditions. Next, offer advice on preventive care and self-medication. Participate in the development, production, testing, and quality control of drugs. Work as part of an interprofessional healthcare team, coordinating with physicians and other health professionals. So they take part also in the process of improving and development of the medications within the hospitals. So they cooperate with the physicians within the hospitals. And finally, in hospitals, pharmacists manage drug selection, provide dosing support to physicians, monitor therapeutic drug levels, and oversee the acquisition and distribution of high-quality drugs. These are the main roles of the pharmacists in Germany as a part of the healthcare system in Germany. It's so crucial. It's not only about dispensing prescriptions. Yeah. So back again, an overview of healthcare system in Germany. Germany has a universal healthcare system in public and private insurance. There are two types of health insurance in Germany. The statutory health insurance, which is public and also sometimes can be known as the state health insurance, or on the other hand, the private health insurance. Public insurance, and that's the abbreviation in German, which is gesetzliche Krankenversicherung. It will be clarified and it will be also mentioned in the own PPT. I will upload this PowerPoint presentation by maximum Friday. Gesetzliche Krankenversicherung covers most medical expenses. Private insurance, which is private Krankenversicherung, that's the equivalent term in German, private Krankenversicherung, is available for high income earners and self-employed individuals. I want here to make a simple and an overviewed and a briefly comparison between these two types of insurance in Germany. For example, for the statutory health insurance or the public insurance, they are for all employees and it's mandatory for the employees, compulsory, provided that the income threshold is 73,800 euros annually, which is 6,150 euros monthly. So if your earnings, if your gross earnings, if your income is up to this ceiling, is up to this amount, you have to have statutory health insurance in Germany. And if your earnings is above this limit, you earn more, then you can choose to have the private health insurance in Germany. And also the private health insurance is for the higher income earners. I mean, above this income threshold, which is 73,800 euros annually or 6,150 euros monthly, but also for the self-employed, for the civil servants, and also for the artists and professional freelancers. The second point in the comparison between these two types of health insurance in Germany is about the premiums. The premiums for the public insurance or for the statutory health insurance in Germany is based on income. Whether in case of the private health insurance in Germany, the premiums is are based on age, health, and the desired covered services, the desired coverage level, the level of coverage desired from the private insured patients. The third point of the comparison is the non-working independents. For example, the non-working independent spouses, children under 18 years old can be added to the statutory health insurance in Germany at no extra costs for free. But it's not the case when it comes to private health insurance in Germany, where every family member has to have its own premium, has to have its own private health insurance scheme. And finally, the services. For the public insurance or for the statutory health insurance in Germany, it has a standard and comprehensive package of benefits and services. But there is disadvantages of, for example, longer wait time. In case of public insurance, there is longer wait time in hospitals for the public insured patients. And also, you have to be referred from your general practitioner or from your primary care doctor to a specialist in hospitals. But in case of the private insurance, health insurance in Germany, it comprises a wider range of services and also a better level of services provided for the private insured patients. You don't have to wait longer time, and also you have a direct access to your specialist, to the specialist in hospitals without being or without having to be referred by your general practitioner to a specialist in the hospitals. So it's a general comparison between the two types of public insurance and private insurance in the healthcare system in Germany. and you also will find this comparison clarified in my own PPT. You need a Krankenversicherungskarte, health insurance card, when visiting a doctor. And there is two types of Krankenversicherungskarte, or the health insurance card in Germany. There is the German health insurance card, and there is the European health insurance card. The European health insurance card, for example, for someone that's in Germany, he is in German, but he's in Germany for tourism, for example, or for a visit for a friend in Germany. And he has some health issues and suddenly, and he want to get a visit, or he want to visit a doctor according to his type of insurance in his own country. And that's why he has in Germany his European health insurance card. So he can use his European health insurance card, and it functions as typically as the German health insurance card. So these two types of health insurance cards are the only type of insurance cards used in Germany or in general in Europe. Next, this is an illustration for the healthcare system in Germany and how it operates. And also it highlights the importance and the role of the Federal Joint Committee and how it's made up of, or what it's made up of. You don't have to get into these complicated details in this illustration, but the most important things I will mention to you about, for example, the main umbrella entities from which the Federal Joint Committee is formed. The Federal Joint Committee is formed of the German Hospital Federation, hospitals, regional hospital associations, its association for hospitals in Germany that are registered in the statutory health insurance system in Germany. Second, we have the National Association of Statutory Health Insurance Funds. That's the insurance funds in this type of insurance, with this statutory or statutory health insurance. So State Association of Health Insurance Funds is the second entity. The third entity, National Association of Statutory Health Insurance Physicians, associations of physicians, members representing physicians in Germany that are registered in the statutory health insurance system. So physicians and dentists, regional associations of statutory health insurance physicians. And finally, the entity of statutory health insured patients. These are the four main umbrella entities of the Federal Joint Committee. The Federal Joint Committee, as I've mentioned, as to refreshing to your information, or as to remembering for your information, revising your information, the Federal Joint Committee is the highest entity of the self-governance within the statutory health insurance in Germany. It's responsible for decision making regarding the services, for example, in the healthcare system, and in particularly in the statutory health insurance system in Germany, the medical services, for example, the facilities in the hospitals, how it's financed from the Association of Statutory Health Insurance Funds, and also to make limits or to separate between the services that's provided to the statutory health insured patients and the services provided to the private health insurance insured patients. And also the physicians the physicians that also take part in the Federal Joint Committee or members representing them, physicians and dentists, to inform about the services and the medications um, that have to be covered in this type of insurance, which is statutory health insurance in Germany. And they, for example, negotiate with the Association of Statutory Health Insurance Funds in order to calculate how much do these all outpatient services and treatments cost in order to be covered from this association, the Association of Statutory Health Insurance Funds. So these are the main entities of the Federal General Committee. And we have also the National Ministries of Health, the Federal Ministry of Health, and their role is only about supervision. Yeah. The legislative authority, which is the parliament in Germany, which is Bundestag or Bundesrat, they form a legal framework for the National Association of Statutory Health Insurance Funds. They form this legal framework for them, for this association, in order, for example, to empower this Association of Statutory Health Insurance Funds to address the financial problems or financial challenges, or in order to empower this Association of Health Insurance Funds to, for example, invest in innovations, in health innovations, and so on. Here, for example, we have, for example, the cooperation between the German Hospital Federation entity and the National Association of Statutory Health Insurance Funds. They negotiate about the budgets of cases. For example, the facilities that the German hospitals need in order to fulfill the needs of the statutory health insurance insured patients in Germany. So, for example, the German hospitals say, okay, I want these, for example, these facilities needed to be renewed, and so on. And the negotiations are made about this point, and this coverage has to be made by the National Association of Statutory Health Insurance Funds, by this entity. That's an example. And also the cooperation between the Association of Statutory Health Physicians and the Association of Statutory Health Insurance Funds. For example, it's about the cooperation, it's about the remuneration evaluation for the outpatient services, as I've mentioned a few moments ago. It's about the outpatient services and how they are remunerated, how they are covered, and how the physicians also are remunerated, and if there are any changes, any new, for example, new procedures that have to be made, have to be filled, or anyway have to be made by the Association of Statutory Health Insurance Funds. The Association of Statutory Health Insurance Physicians point out to these outpatient services and outpatient treatments, medical treatments, and any other expenses also concerning the physicians themselves. And we have, for example, also the statutory health insured patients and they have to be represented within the Federal Joint Committee. Members from the patients, from the insured patients, have to be represented in the Federal Joint Committee in order to their voices be heard and their needs be heard from the Federal Joint Committee, and the other entities of the Federal Joint Committee have to hear the needs of the insured patients, and that's why it's a must to be exist or to be existed in the Federal Joint Committee. For example, here the health insured patients have freedom of choice of the Association of Statutory Health Insurance Funds. That means there is 110 health insurance funds in Germany, and the insured patients can freely choose the health insurance funds that they want to make a contract with it freely, but provided that at least you have to be in this contract with this particular health insurance funds for 18 months. Then you can alter to another health insurance funds as you like. And also it's another form of cooperation or another form of relationship between the health insurance funds and the health insured patients with this obligation to contract. That means that the health insurance funds are obligated to make contracts with the health insured patients according to their needs and according to their wishes. And as I've mentioned, the Federal Ministry of Health and the National Ministries of Health only supervise, only oversee the operation and the process and how the healthcare system in Germany operates without any interventions. Finally, the Federal Social Insurance Authority supervise also the Association of Statutory Health Insurance Funds and how they efficiently use the funds, use the premiums in order to develop, to maintain at first, to maintain the level of provided services, medical services within the statutory health insurance system, and also how to develop, they monitor, or they oversee, or maybe they also supervise only the Association of Statutory Health Insurance Funds in the process of development and improving the medical services provided for the statutory health insured patients in Germany. That's an overview of this illustration. I mean, it seemed to be complicated somewhat, but if you divide this illustration into the entities of the Federal Joint Committee and how they interact with each other and to which goal, as I've illustrated, and between the organizations or the national and federal organizations that only supervise what the healthcare system entities or the Federal Joint Committee entities operates and how they interact with each other. It's about only supervision, and the main and the core process lie in the responsibility of the Federal Joint Committee. So don't be panic or don't be nervous. Next. How to describe health issues in German. I have added some of these expressions and also some additional expressions and phrases to my own PPT with its proper pronunciation in German. So I'll pronounce it properly now for you, and you will also find the proper pronunciation for For these expressions and phrases, and also for additional expressions and phrases to this topic in my own PowerPoint presentation. Ich fühle mich nicht gut. I don't feel well. Ich habe Kopfschmerzen. I have a headache. Ich habe Bauchschmerzen. I have stomachache. Ich habe Halsschmerzen. I have sore throat. Mir ist schwindelig. Mir ist schwindelig. I feel dizzy. Ich habe Fieber. I have a fever. Ich habe Husten. I have cough. Ich habe Schnupfen. I have runny nose. And you'll also find in the PowerPoint presentation synonyms for example, ich habe Schnupfen. You can say meine Nase läuft. And it's also illustrated later on in this PPT or in this illustration or in this module. Or you can say mir läuft die Nase. Mir läuft die Nase. And finally, ich bin allergisch gegen. I'm allergic to. Next. German health phrases. Ich habe Fieber. Ich habe Fieber. I have fever. Meine Nase läuft. I have a runny nose. Or ich habe Schnupfen. Ich habe Husten. I have cough. Ich habe Rückenschmerzen. Ich habe Rückenschmerzen. I have backache. Ich bin krank. I am sick. Die Erkältung is cold, and you can describe it also if you say ich bin erkältet. I'm feeling cold. Ich bin erkältet. Der Schmerz, the plural form die Schmerzen, pain. Der Kopfschmerz, the plural form is die Kopfschmerzen, headache. Der Halsschmerz, sore throat, and the plural form is die Halsschmerzen. Der Rückenschmerz, back pain or backache, and the plural form die Rückenschmerzen. Das Fieber, fever. Der Husten, cough. Niesen, to sneeze. Das Verb or the verb niesen, to sneeze. Das Thermometer, thermometer, and the plural form die Thermometer with the same pronunciation. Der Magenschmerz, die Magenschmerzen, it's the plural form, which is stomachache. As Bauchschmerz, die Tablette, which is tablet or pill, the plural form, die Tabletten. Prescriptions and medications. Here's some vocabulary, some common useful vocabulary in prescriptions and also by using medications. Präventiv, preventive. Der Klon, Clone. Das Geschwür, Abszess. Die Autoimmunisierung, die Autoimmunisierung. Autoimmunization. Autoimmunization, der Primärtumor, Primary Tumor, Hypophysectomie, Hypophysectomy, der Nucleus, Nucleus, der Pathologe, Pathologist, die Punktion, Puncture, Exocrine, catalytischer Ort, catalytic site. So these are some common phrases in prescriptions and medications, and also you will find some other additional expressions and phrases in my own PowerPoint presentation. Here are the main types or all types of medical prescriptions in Germany. We have first the red or pink prescription. Kassenrezept. That's the equivalent term in German. Kassenrezept. A red prescription is often issued by a doctor to those with statutory health insurance. That's the public insurance or the stated insurance or the state insurance. The statutory health insurance patients will pay the cost of the product with this prescription. That means that the association of funds, the association of the statutory health insurance funds, will pay this the cost of this prescription, not the patient itself. And it's valid for 4 weeks, for a month. The second type, blue prescription, Privatrezept. It's the equivalent term in German. Patients with private health insurance get the blue color prescriptions. One must first pay for the medication and then get it reimbursed by the insurance company. Here, the first thing is that this term Privatrezept, and it's called so Privatrezept, privat, because it has to do with the private health insured patients. This blue prescription, the private health insured patients become these blue prescriptions from the specialists. And that's why it's called private or Privatrezept in German. The private health insured patient will have to pay upfront for this cost of the prescription until he will be reimbursed back from the insurance company, from his insurance company later on. And it's valid for 3 months. Green prescription, Empfehlung. This is just a doctor's advice for non-prescription drugs that aren't covered by health insurance. These medications must be paid by the patient. Because it's non-prescription drugs, it's over-the-counter drugs. And that's why the patient, for example, the statutory or the private health insured patients can have these Empfehlung or can have these advices or these recommendations from the specialists about any over-the-counter drugs. And that's why the patients have to pay for the cost of these medications himself. Empfehlung is recommendation. Empfehlung is the equivalent term of recommendations. It's indefinitely valid. And finally, the yellow prescription, Betäubungsmittel, has to do with drugs and so on. The doctor prescribes the yellow prescription for Narcotics Act medications, example, strong painkillers such as morphine. For painkillers, for example, and you know that many patients may go to the pharmacist and ask about painkillers. And in this case, without prescription. In this case, the pharmacist asks for the prescription because it's so important to say prescription with the painkillers. Yeah, it's prohibited to dispense painkillers from the pharmacist without a prescription. And that's why this yellow prescription is issued by the doctor or ist Betäubungsmittel, it's the equivalent term in German, in order to dispense these types of painkillers, for example, for the patient. And it's valid for a week, 7 days. Next, understanding prescriptions and medication. These are some other additional vocabs and common phrases for prescriptions and medications. Arzneimittel, medication. Rezeptpflichtig, prescription required. That's the medicine that requires a prescription that can be dispensed from the pharmacy without a prescription. Rezeptpflichtig, rezeptpflichtig, prescription required. Frei verkäuflich, it's the opposite. Frei verkäuflich, over the counter. Wie oft soll ich das nehmen? Wie oft soll ich das nehmen? How often should I take this? Hat das Nebenwirkungen? Nebenwirkungen, side effects. Does this have side effects? And finally, pharmacists provide advice on medications and alternatives. As I've mentioned before, as I have shown before to you, the role of pharmacists in the healthcare system in Germany. And now, emergency situations. What emergency numbers are there or exist in Germany? There are two main emergency numbers, the police and fire department, or the police you call 1110, 110, 110 in Germany for emergencies related to criminal offenses, for example, being in an emergency situation or being witness of such a scene that requires police attention. 112 is the second emergency number that you have to call in case of fire or in case of rescue. So in emergency situations where assistance is immediate, has precedence over 110. Always add this number for fires, medical incidents, or severe accidents. If in doubt, use this number, which can be transferred to the police if required. And be prepared for these questions when you dial these numbers. Where, who is calling? Who are you? Wer sind Sie? Wo? Where is the incident? Wo? Was? What happened? Wie viele? How many? How many people are involved? Yeah. Warten, wait for further instructions. And I want to this context to add another form or another emergency number for pharmacies, emergency pharmacies, if you want to call or dial a pharmacy in emergency case. So this number from a landline or this number, which is also the end of this number from the landline from a mobile. Yeah. So back again. Emergency phrases in German. First, we'll talk about injuries. Ich habe einen Sonnenbrand. I have a sunburn. Ich habe mich beim Kochen geschnitten. I cut myself while cooking. Mein Knie ist geschwollen. My knee is swollen. Ich glaube, ich habe mir den Knöchel verstaucht. Ich glaube, ich habe mir den Knöchel verstaucht. I think I sprained my ankle. Ich wurde von einer Biene gestochen. Ich wurde von einer. These are some common phrases when it comes to injuries in Germany. Im Krankenhaus or in hospital. These are also some vocabs and some common expressions you can use when you are in hospital. Ruft den Krankenwagen. Call the ambulance. Ruft den Krankenwagen. Call the ambulance. Der Patient oder die Patienten wird in die Notaufnahme gebracht. Notaufnahme is the emergency department in the hospital. The patient will be brought to the emergency room. Der Patient oder die Patienten wird in die Notaufnahme gebracht. Auf einer Trage. On a stretcher. In the ambulance. Auf einer Trage. On a stretcher. Im Rollstuhl. In the wheelchair. Röntgen. Röntgen. To take X-rays. Untersuchen. To examine. Füllen Sie bitte dieses Formular aus. Please fill in this form. Füllen Sie bitte dieses Formular aus. The verb here is ausfüllen. Der Patient wird operiert. The patient will be operated. Der Patient wird operiert. Die Prognose ist nicht schlecht. The prognosis isn't bad. Wir bereiten den Patienten für die Operation vor. We are preparing the patient for the surgery. Wir bereiten den Patienten für die Operation vor. Die Krankenschwester fühlt seinen Puls. The nurse is measuring his pulse. And you can say also, die Krankenschwester misst seinen Puls. Yeah. Next, when you call an ambulance, what you say? Ich brauche einen Krankenwagen. I need an ambulance. Jemand ist verletzt. Someone is injured. Mein Freund, mein Familienmitglied hat Atemprobleme. My friend or my family member has breathing problems. Ich bin bei, and then you mention the address. Bitte schicken Sie Hilfe. When you call the ambulance. I am at, and then the address. Please send help. Common first aid phrases. Legen Sie sich hin. Lie down. Legen Sie sich hin. Bleiben Sie ruhig. Stay calm. Bleiben Sie ruhig. Atmen Sie langsam. Breathe slowly. Atmen Sie langsam. Gibt's einen Arzt hier? And finally, hospitals use Notaufnahme for emergencies. As I've mentioned, the emergency department in the hospital in German is called Notaufnahme. Notaufnahme. Aids or automated external Defibrillators are available in many public places in Germany. Knowing basic German phrases can help in urgent situations, and we have learned together many phrases and expressions using, for example, when calling an ambulance, using in hospital, using in first aid situations, and using in emergencies. Always carry an emergency contact card with important health information. This emergency contact card, it's about your information, about your health information, about your also contact information about the people in emergency cases, and your health information about your, for example, if you have any pre-existing conditions, if you take specific medications, for example. This card you have to have in your wallet, for example, in your um, um, maybe in your purse, in cases of emergency, in cases of that you can't contact anyone. So the first person that contacts you or that find you or that can help you um, and to and provide you the utmost and the appropriate services and treatments according to this emergency contact card, because you can't communicate with them, but through this card they can know all about you, all about your health issue, and all about the people that they can contact. So you have to carry this emergency contact card for that reason. And it's also free to issue. You can issue this card for free without any extra cost. That's it for today. We talked today about the healthcare system in Germany in general, and in particular in about health insurance in Germany and about the two types of the health insurance in Germany, the private and the statutory health insurance. And we talked also about the origin of the healthcare system in Germany. We talked about the Federal Joint Committee and its role and what it's made up of, and the role of the Ministry of Health, whether the National Ministries of Health or the Federal Ministry of Health, and also the interconnections or the cooperations between these different entities in order to operate the healthcare system properly and efficiently in Germany. We have learned also some common phrases used in emergency cases and used in the first aid situations in hospitals and when calling the ambulance. We have learned also the emergency numbers that we have to call in emergency cases. And finally, we have learned some basic informations about the emergency card, the emergency health contact cards. Thank you for today. Thank you for your participation. Thank you for watching this video and wishing you having a good day and see you next time. Thank you. Bye bye.